A woman walks into a community center in Ecuador. Settling into the plastic chairs, she's thinking about all of the problems that she's facing, struggles financially, problems with her family, a cancer diagnosis. She's completely overwhelmed with despair. And maybe you felt like this yourself. But then over the next hour, talking with the other people, she starts to realize she's not alone. And then over the next 8 weeks, she starts to feel something she never thought she'd feel again, a sense of hope. This woman's named Bella, and she's a real woman who went through a Vida Plena program. And her story of healing is replicated hundreds of times over. Depression is one of the largest drivers of disability worldwide, yet remains chronically neglected. Just as a point of comparison, depression and other mental health disorders cause nearly twice the number of years lived disability as, say, malaria. And tragically, deaths by suicide have surpassed those to malaria. The point isn't to compare pain, but the point is to point out the gap between the burden and the response. Because the fact of the matter is that almost 50% of people living in Ecuador will suffer from depression or anxiety in their lifetime. And you would think that philanthropic giving might make up the difference, but in Latin America, it doesn't. We only receive 10% of giving worldwide. So what we have here is a vastly neglected problem and a response that is barely scratching the surface. But now let me give you the good news. We have a treatment that works. It doesn't require expensive psychiatrists. It doesn't require massive scaling of clinics. It's recommended by the WHO, and it's backed by decades of RCTs. My name is Joy Bittner, and I'm the founder of Vida Plena, alongside my co-founder Anita Caslin, who is an Ecuadorian clinical psychologist, and we're proud to be the first organization in Latin America implementing group interpersonal therapy. We've been working alongside Columbia University to provide rigorous training and carefully monitoring of every single person who's gone through our doors. And since launching with the Charity Entrepreneurship Program in 2022, we've treated almost 2,000 people, and the results speak for themselves. 84% of people who go through our program will have clinically significant improvements in their depression or anxiety, and 82% of people will have a reduction in their suicidal thoughts. And we're exceptionally excited that we've been able to demonstrate that these results hold 6 months out. So I want to tell you where we're going from here. We started with direct service, implementing through our own team, and now we're moving on to phase 2, scaling through government. Last year, we did a pilot with the city of Quito. It went so well, they asked us to triple the size. This last year, then we also began a partnership with the Prefectura de Imbabura, the provincial government, which we trained 25 of their community outreach workers. And just 2 weeks ago, we were invited by the Vice President's office, who is now in charge of the Ministry of Public Health, to partner alongside of them to help scale and develop a community-based mental health program. Our ambition has always been to scale nationwide, and now we are at a pivotal moment in which we have the opportunity to do so. We're not talking about simple dollar in, dollar out. We're talking about a hockey stick of impact. And so we need your help. We're looking for volunteers who have experience working, scaling government programs, who know how to do quality-based interventions, who know how to do monitoring work. And so if this is something you're excited about, seeing a program truly scale and become self-sustaining, I'd love to hear from you. We need your help. We believe this is the possibility of seeing a government fully take on their own mental health and ultimately see a nation heal.
G'day, I'm Hugh, CTO at Kaya Guides, and I'm going to tell you a little bit about what we do. Mental health is severely underserved in India. There are over 67 million people with depression in the country, but over 85% of them don't get any treatment whatsoever, which is substantially worse than other countries at India's income level. Furthermore, 1 in 3 global female suicides take place in India. It's a big and hard to tackle problem because mental health is very expensive for average people to afford. There just simply isn't enough resourcing. For example, India has 1/80th of Europe's psychiatric resourcing. And finally, the government doesn't spend any money on it. They only spend $3 per depressed person federally And in some states, there's no money earmarked for mental health services directly. As such, we can't solve this problem by scaling Western-style therapy. We need something that's going to be highly scalable and very low cost. Guided self-help happens to be a solution. It's a form of therapy that has the same effects as face-to-face therapy, but for a fraction of the cost. You can deliver it in as little as 15 minutes per session with non-clinicians that you train yourself and fully digitally. The WHO, based on these results, developed a guided self-help program called Step by Step to treat Syrian refugees in Lebanon. We're the first external implementer of Step by Step. Basically, the way that it works is participants will find our program through digital ads that we run on Instagram. They'll book a call with a counselor. And then over the next 5 to 8 weeks, we send them short TikTok-style clips that teach them depression coping techniques. And then once a week, they'll have a 15-minute call with one of our counselors. This turns out to produce very, very good results. One of our collaborators at the WHO, the developer of Step by Step, Dr. Carswell, believes that our results are comparable to the ones that WHO found in their own RCTs, and that we have the capacity to scale this program in a similar way that they've done so in Lebanon. Looking at those results directly, we can see that they are indeed very, very similar, with over 38% of our participants in the past 2 years reducing their depression by more than half at a reasonable estimated effect size. We're going to be exposing our program to an RCT in 2026 to verify and validate these results further. We are already more cost-effective than cash transfers, despite having only operated for 2 years. In that time, we've treated 3,000 people, including 2,300 this year, at a cost at present of $60 per beneficiary. But better than that, most of that cost is non-marginal costs. So it's just the fixed cost of running the program that will scale or better over time. We only actually cost about $12 in program costs, including less than $1 in participant recruitment, which is a fraction of the size of non-digital programs. We've estimated using a methodology from the Happier Lives Institute that we're probably about 2.7 times as cost effective as Give Directly. And in 2026, we're excited to announce that Founders Pledge are going to recommend us as a high-impact mental health charity, although this isn't public yet. Over the rest of the decade, we think that we can go from being 2 times as effective as cash transfers to 22 times as cost effective. And you can see that part of this is just due to our superior model. The fully digital delivery and the guided self-help means that we can deliver mental health treatment for for a much lower cost than competitive charities such as Strong Minds and Friendship Bench. And we believe that this has the potential to raise mental health within EA to be taken more seriously as a cause area. If you're interested in learning more, I recommend shooting me an email, and you can also try out our chatbot by scanning the QR code to the left. Just a quick heads up with the chatbot though, don't book a call with a counselor. If you follow the instructions just listed below the QR code, you'll be able to just view the program directly. Thank you so much, and enjoy AIM Connect.
I'm guessing it would be fair to say that every single one of us has lived through a moment where emotion took over. Maybe we sent a message that we didn't mean, or maybe we snapped at someone we love. And usually those 3 seconds of anger or fear or sadness are very embarrassing, but they are solvable. That's not the case for everyone. For teenagers in high-risk neighborhoods in Latin America, where I'm from and where I live, those same 3 seconds can shape the rest of their life or even tragically end it. In contexts where violence is normalized, or if they're already holding a weapon, or if their peers are watching and they want to show off, those 3 seconds can lead to choices that we couldn't even imagine. And that's not because they are bad people or dangerous people. That's just because no one ever taught them the skills that they need to navigate those 3 crucial seconds in their life. When we think about violence in Latin America, the TVs and the movies have told us to think about cartels and gangs. But what the TV doesn't show us is that these 3-second moments, when someone simply loses control, account for 40% of the homicides in cities like Bogota and up to 90% of the non-fatal assaults. And that is where ACTRA comes in. We deliver group-based workshops to teach these at-risk young kids the tools they need to better manage the 3 hardest seconds of their life. Things like emotional regulation, critical thinking, conflict resolution, and planning ahead. Through this, we target the actual behavioral drivers of crime and violence. things like impulsiveness or lack of executive function or lack of emotional regulation. And we do this using an intervention that has the strongest evidence base in the whole crime prevention field. More than 50 randomized controlled trials led by organizations like JPAL or the Chicago Crime Lab show a 25% reduction in criminal relapse on average for all CBT interventions. And for the highest quality ones, they show up to a 50% reduction in recidivism. Our goal is to adapt this success to the region that needs it the most, Latin America. And we're thinking about scale from day one. Instead of parachuting in with a brand new team, we're leveraging the millions of dollars already spent in programming for youth in the region. In only our first year, we've partnered with the government of the third largest city in Colombia and with 2 NGOs with more than a decade of experience treating our target populations. To them, we offer capacity building so that they can incorporate behavioral-based and psychological skill strengthening approaches to the services that they already offer. This allows us to operate at around half the cost per participant of peer organizations that we've seen elsewhere. We are very proud to have built a curriculum that is engaging, that is contextualized, and that most importantly, we think is working. In fact, one of our large NGO partners who has worked with formerly imprisoned populations for over a decade at first warned us that a 40-hour-long curriculum like ours would be lucky to see a 10% completion rate based on what they had seen before in the sector. In fact, we have achieved over 80% retention rates and a 0.25 standard deviation improvement in the psychological skills that are linked to safer behaviors. Both local partners and external experts are noticing this promise. Earlier this year, we were very honored to receive an honorable mention by the Happier Lives Institute, which is an evaluator focused on recommending cost-effective interventions based on well-being metrics. And we really want to fulfill the promise that they see in both our intervention and our team. Going into our second year, we really want to hire more talent so we can keep building capacity in local institutions. And we want to be able to try it out in different settings like public schools, youth centers, detention facilities. We want to identify the version of ACTRA that can reach thousands of people across the region and hopefully cut our homicide rates in half. We would love for you to join us. We want to build a future where those 3 seconds are still life-changing, but for the better. My name is Laura Castro. I am ACTRA's co-founder and executive director, and you can learn more by following us on LinkedIn or reading the recent post that we published in the EA Forum for Marginal Funding Week. Thank you so much.
Hi everyone, my name is Evie.
Hi, I'm Alexis. And together with Evie, we co-founded NOVA, which stands for No Violence at Home. And what we do is that we use radio dramas to prevent domestic violence.
So unfortunately, domestic violence against women is a huge global issue. So every year, 230 million women get abused by their partner. And in East Africa, where we work, it's 1 in 4 women each year gets abused by their partner. And unfortunately, the issue is not getting a lot of attention. So only 0.2% of global aid is going to prevention of domestic abuse. And with NOVA, we want to prevent domestic abuse by broadcasting edutainment radio dramas that can really change minds and behaviors at scale. Because it's such a big issue, we need to focus on a solution that is highly scalable. So we create radio dramas that are based on behavioral theories. And in these radio dramas, people see the stories of highly relatable couples that have different kinds of relations. And they start reflecting on their own relationships and are encouraged to take small steps every day to make their relationship a little bit more healthy and less violent.
At the end of last year, we produced our first season, Tobacane, which means for Let's Build Together. At the beginning of this year in 2025, we aired it and then we evaluated it. And I think we found promising results with this early program. First, on airing, we found 30,000 active listeners, that is a 7% reach because we aired on a regional radio station, which is promising in terms of listenership. Second, we found strong reported changes in our qualitative evaluations, in particular on gender equality, on communication at home, on seeking help behaviors, which were exactly the steps that were designed in our theory of change to go through impact. And lastly, because this was promising, we conducted a small quantitative pilot study with 200 couples with a small control group baseline and line study. It was not designed to bring statistically significant results, but still we found a 6 percentage point reduction in violence. That represents a 40% relative decrease in violence. And that is in line with what we expected to find in the literature. And the couple on the picture on the right, they were participants in our study, and typically the husband explained how he changed. And he said, I understood that I cannot say anymore, I am the man, I have spoken, and this is what will happen. Not only because this is not right, but also because this won't work for his household, for his family. At the end of this year, we produced a second season, season 2 of Tubakane, a longer 12 episodes designed for scale. And what we aim to do next year is first to rigorously evaluate it. We're conducting, and we have started in our city with Innovations for Poverty Action with 1,200 participants. Secondly, after the end of our city, we will air at scale for impact. We aim to reach 1 million listeners and to protect 13,000 women from violence in Rwanda. And during that time, we aim to already start expanding regionally, starting with Burundi and then across East Africa, where radio listenership is high and violence is high.
So we make projections about our cost effectiveness, which still need to be confirmed by the rigorous evaluation we're going to do in 2026. But for now, these are our estimated impact figures. So we estimate that for $25, we can protect a woman from violence for 1 year. We can save a DALI for $85. And at scale, we can produce a 3-month campaign for $200,000. Which, of course, the numbers still need to be confirmed, but this is for now our projected cost effectiveness. So thank you very much for listening to this very short presentation about NOVA. We love to hear from you, any feedback you have, any questions you have, or any critique you have. So you can reach out to us or go to our website to learn more. And thank you very much for listening to this presentation.
Thank you.